Hello, my name is Dr. Julian De Silva. I'm a London-based facial cosmetic and plastic surgeon. Today I'm talking you through what are the components that are used in face and neck lift surgery, how are these areas improved. Well, in terms of the neck, common changes that we see in the neck are fullness in the neck. Access the neck, we need to make a small incision, and that can be made under the chin in a natural line. There's a natural crease that occurs in everyone after the age of about 30, and so we can conceal the scar in this natural crease. Now in this area there's fullness, and the fullness is often partly related to having a cushion of fat in this area, and so a common way of addressing this is to do a little bit of liposuction that will reduce that fat volume under the neck. Now it's important to be conservative with any liposuction in this area because actually fat is an incredible cushion of the skin. The fat tends to make everything flat and smooth and even, and so it's very important not to strip away that fat, because if that's done, it will enable you to see the underlying anatomy of the neck. Now, underneath the fat is the muscle of the neck called the platysma, and the platysma extends from your collarbone to your jawline, and when you're young it's like a tight elastic sheet, but with time it tends to become loose and you start to see a pair or single band in the neck. So the principles of face and neck lift surgery is to reoppose that band almost like a corset to make the neck smooth and even and to reshape the contour of the neck. Now in a smaller proportion of people there can be really quite a lot of fullness in the neck, and one of the common reasons for that is just more soft tissue. And in some of those patients, the salivary gland, the submandibular salivary gland, has descended down below the jawline, creating that fullness. And in those patients, a more advanced technique would be to reshape that salivary gland and just to reduce the volume in the neck. And that it can be a very powerful way of improving the contour and improving the shape in the neck. From my experience, patients have said they have had the best neck in their entire life, even compared to their 20s and 30s. Ultimately, what gives the best results with face and neck lifting is really lifting, because that's restoring the areas that have descended with gravity, and that's something that is very difficult to effectively do with non-surgical means. Most patients who have changes in the neck really will benefit from a facelift as a combined approach to give them the best possible result. With facial aging, it's really the shape of the face that can change. With effects of gravity, loose skin, you tend to have more fullness along the jawline that creates a more square shape to the jaw. With face and neck lift surgery, well, we're restoring that V-shaped jawline, recreating the angle between the jawline and the neck, recreating that V shape, reducing the jowls and the changes with soft tissues, and that creates a more youthful and attractive appearance to the face and neck. And every single patient has difference in terms of how much skin laxity, how much effects of gravity, and so the surgery has to be tailored towards each individual person. Some patients may require just mini facelift surgery and have less changes, whereas some patients may need more advanced techniques if they have a lot of fullness and aging of the neck. We've covered a lot of the anatomy. We've talked through what are the procedures in terms of improving the changes in anatomy, the biggest difference in giving you a natural result, faster recovery. I hope this information has been useful for you. Thank you for watching.